So hello students, today topic of discussion is the pendulum appliance. So first of all, you have to remember is who first of all discovered this appliance. So remember James J. Hilger of California. So remember for your exam, who first of all discovered this appliance? Well, it was James J. Hilger of California, who first of all introduced the pendulum appliance. So next we have to know is what is the pendulum appliance? What is it used for? That is the first question that usually comes to your mind. So well, it uses, what it does is it uses force to distalize the upper first molar to create space for eruption of third molar for correction of the class 2 malocclusion. So what you see is it is an excellent technique. It is an excellent technique to correct class 2 malocclusion without resort to extraction. So remember, this distalization is more efficient before the upper second molar have erupted. Now, where can we use this appliance? Think, when there is forward positioning of 1 molar due to the early loss of the deciduous teeth, or when there is mesial drifting of the teeth, that is the root cause of the malocclusion. So do you know, even we can use pendulum springs on one side that can regain space without putting any strain on the other part of the upper arch. So what will you see? As we know that the pendulum appliance, what will it do? It will cause distalization of the molar. Along with that, what will you see is that the distalization that will cause downward and backward. It will cause downward and backward mandibular rotation. That occurs in the clockwise direction. So what will it cause? It will increase the anterior facial height, particularly the lower third. Also, it will increase the facial convexity angle. So there will be increase in the mandibular plane angle with respect to the base of the skull. So there is increase in the lower anterior facial height due to the clockwise mandibular rotation. Now, can we use this appliance in class 1 and class 3 malocclusion? No, it is used to correct class 2 malocclusion. So well, that is correct. If there is excessive lower facial height, can we use it? No, we can't use it, as it increases the lower facial height. So suppose in patient, when there is a short lower face height, yes, this is the situation where we use the pendulum appliance. That is what you have to remember for your exam. Can we use the pendulum appliance in class 2 skeleton base? No, it is not used. It is used in class 2 or end-on and molar relation cases. Can we use it in skeleton open bite or dental open bite? No, because it will sometimes cause anterior open bite. Now let us discuss the components of the pendulum appliance. What are the components of this appliance? Number one, it consists of Nance acrylic button, TMA spring, along with wire component that includes closed helix, small horizontal loop, and the wires, small horizontal loops, and the wire connecting on band to the first molar and the second premolar. So what we have is small horizontal adjustment, a closed helix, a loop for retention in the acrylic button. Now, what is this? What is the use of this Nance anchorage? So it has a large Nance acrylic button in the palate. Its purpose is for anchorage. What is the use of TMA spring? Well, that spring will deliver light continuous force to the palate aspect of maxillary first molar. So what would this appliance do? So what you will see is the appliance, it will produce a swinging arch or pendulum of force from the midline of palate to the upper molars. So this distalization is produced by opening the helix, forcefully engaging the distal ends into the sleeve. So what you will see is, so once the appliance is in mouth, the springs are inserted into the lingual sheath of the molar bands to allow forces to be distally. So there is a readjustment of springs, remember, every 3 weeks. So as the molar move distally, the forces of springs that will cause molar to move in arch toward the midline of the palate. So that could lead to the, remember, that could lead to the cross bite in the posterior teeth. So in order to avoid this side effect, what we do is we make adjustment loops to counteract this medial movement of the first molar. Other thing that you have to remember is the upper molar. They are utilized into the to place a transpalatal arch or Nance appliance immediately after the removal of pendulum appliance. So let us discuss now some important things, some important values that can be asked in your NEET exam. First thing that you have to remember is the pre-activation of appliance. The mandates bending of the TMA spring 90° or parallel to the midline of the palate. Second, the initial activation that will that will generate a force of 250 gram of force per side. And distalization arm or spring, they are constructed from 0.6 mm stainless steel round wire that is consist of close helix and U loop. So that is the important values that you have to remember for your exam. And the TMA springs that we use is of 0.0232 inches. So another important value for your NEET MCQ point of view. So these are the important points regarding the pendulum appliance that you all guys have to remember. It is a very important topic that has been asked again and again in either NEET or AIMS entrance exam. So if you know this topic well, you can give a better score in the exam if the questions are asked related to this topic. So this was all about the pendulum appliance. So hello students, today we are going to discuss is the Molar Digitalization appliance. So the next appliance that we are going to discuss in the Molar Digitalization is the K loop. So the appliance that consists of the K loop, it consists of one component that is the K loop and other is the Nance pallet. So what is the function of this K loop? So this K loop will provide force and moment. What this K loop, this one is the K loop. It provides the force and moment, whereas it has a Nance pallet that is used to provide, that is used to resist the anchorage. So this K loop, this question was asked in your AIMS entrance exam. Identify the figure. So this was K loop. So remember it for your INICT examination point of view. Now what is this K loop made up of? So remember this K loop, it is made up of 0.017 into 0.025 inches TMA wire. So why do we prefer TMA? We prefer TMA because it can be activated twice as much as the stainless steel before it undergo the permanent deformation. Where a loop that is made up of TMA, it also produces less than half the forces one made with the stainless steel. So remember, each loop of this K should be 8 mm long and 1.5 mm wide. The legs of this appliance are at 20 degree. That is the point that you have to remember for your exam, that the legs of K, they are bent down at 20 degree. They are bent down at, the legs are bent down at 20 degree and they are inserted into the molar tubes and the premolar bracket. So the wire that is marked at the mesial of the molar tube and the distal of the premolar bracket. The stops, they are bent into the wire that is 1 mm distal and 1 mm mesial to the mark wire. So each stop should be well defined and about 1.5 mm long. So what will these bands do? So remember, these bands will help the appliance. It will keep the appliance away from the mucobuccal fold. So these bands, what they will do is they will keep the appliance. So they will keep the appliance away from the, these bands will keep the appliance away from the mucobuccal fold, allowing a 2 mm activation of the K loop. So remember, these are 20-degree bends in the appliance legs. What they will do, they will counteract the tipping movement that are created by the forces of appliance. And these moments are reinforced by moment of activation as the loop is squeezed into the place. So what will the molar undergo? So remember, the molar that will undergo a translatory moment. So the molar will undergo a translatory movement instead of the tipping. So if the extrusive or intrusive forces are not desired, then it is important to keep the K center between the first molar and the premolar. So for the additional molar movement, the appliance is reactivated. The appliance that can be reactivated 2 mm, that could be done. So we can reactivate this appliance this appliance after 6 to 8 weeks. So if the appliance that is opened in the proper sequence, the reactivation will maintain the original mechanics. So in most the cases, what we see is the reactivation, it will produce as much of 4 mm of the distal molar movement. Now, second component was palatal Nance button. So these button will help the wire extended from the bands on the first premolar or deciduous molar, that will prevent the anterior movement of the first premolar teeth. So this button should be large enough to provide adequate anchorage and prevent the tissue impingement. It should be kept away from the teeth. So this was all about the K loop. So it is important, as per your NEET entrance exam, there was a question asked, identify these appliance. So we have discussed the appliance that is K loop. So this figure was asked in your AIMS INICT exam. Identify this. So remember it for your updates. Is the Jones-Jig appliance. So remember, it was first discovered by Richard Jones. and Michael. So these two both introduced the appliance that is known as Jones jig. So remember, this appliance uses a open coil night eye spring that is used to deliver a force of 70 to 75 gram. So that causes a compression range up of 1 to 5 mm of the molars. So remember, this appliance, it is capable of producing maxillary molar distalization with second molars erupted or unerupted in the mixed or permanent dentition or in the growing or non-growing individual. So Jones jig assembly, what does it consist of? It consists of bands on the upper second premolar that is attached to the Nance palatal arch. So why we prefer Jones jig appliance? The most commonest advantages is that the extent of forward movement of anterior teeth while using this Jones jig appliance is very minimal. It can be used without need of full bended upper arch. So how does this Jones jig work? So what we have is we have a eyelet tube that is placed anterior to the spring. So that is pushed distally, the night eye springs that get compressed and exerting a distalization force on the molars. So this is how the Jones jig appliance work. Other appliance that is important for the distalization of the molar is the skeletal anchorage system. So what this system consists of? It consists of titanium anchor plates and monocortical screws that are placed in either in the maxilla or the mandible. So remember, it has a good advantage that it uses a strong and stable anchorage unit. So it does not involve the single molar teeth distalization, but in mass movement of the maxillary buccal segment. The next appliance is the mini screw supported distalization system. So it consists of two implants that are placed in the paramedian region of the palate. The distalization force, it is applied by palatally positioned open titanium coil springs that passes through the resistance of the maxillary molars. So squeezing these coil springs and screwing the anterior position stop screws activate this appliance. Other important appliance used is MK versatile spring. So the main disadvantage of intraoral distalization appliances that they produce undesirable tipping of the maxillary molar and loss of anterior teeth during distalization. So to overcome this disadvantage, we use MK in shape of MK versatile springs. So it is made up of 0.017 to 0.025 TMA spring in a M-shape pattern. So it consists of two helix. So it has a two helix, one at the central arm and other. So it consists of two helix, one at the central arm and other close to the teeth being mesialized or distalized. So this spring, it is activated by opening both the helix 1 mm for 4 to 6 weeks till the desired movement is achieved. So remember the counterclockwise tipping movement of the counterwise tipping movement created by helix of the first arm is cancelled by the clockwise movement of helix of the central arm that prevents the tipping movement. Other appliance that can be used is the Distilled Jet. So this is Distilled Jet. So it was described by Dr. Carano and Dr. Testa. It is a fixed palatal appliance that produces unilateral or bilateral molar distalization. So the bilateral tubes that are attached to this Nance palatal. The coil springs are to slide over each tubes. So Distilled Jet is reactivated by the sliding the clamps closer to the first molar once a month. Other appliance that is used is the carrier distalizer that is bonded to canine and the first molar. So the Lewis carrier, what he did was he developed a new class 2 distalizer with advanced computer technology. So it is made up of mold injected nickel-free titanium steel. Now, what are the removable appliances that we can use for the molar distalization? First is the Kettling Appliance. So what these appliances do is it involves a combination of extraoral force and the intraoral force in the form of removable appliance. So it utilizes a removable appliance that is attached intraorally to the tips of the crown distally, and then extraoral force that is used to upright the roots. Other appliance that is used for molar distalization is ACCO, that is acrylic cervical occipital anchorage. So what it is, again, a removable acrylic appliance that is used in conjunction with the with the headgear to affect the distal mass movement of the buccal segment. Other appliances that we can use is the molar distalization with the magnets. So magnets were introduced in orthodontics to generate force, field, and bioeffect. So similar, we can use magnets that are encouraged to the NANS appliance cemented on the maxillary first premolar that were activated against the first molar to move them distally. So these are the appliances that we use for the maxillary molar distalization.